Hi, my name is Lily, and the field of science that I'm most passionate about is psychology. So what is psychology? It is the study of the human mind and its behaviors. There are many factors that scientists study that contribute to our understanding of our thoughts and behaviors, but what I'm most interested about is the science behind disorders, specifically obsessive compulsive disorder. So obsessive compulsive disorder, also known as OCD, is an anxiety disorder where the individual has repeated unwanted thoughts that make them driven to do something. So imagine that your mind is stuck on a certain thought or image, and that image was played in your mind over and over again, and there was nothing you can do to stop it. It overpowered you. This is what having OCD feels like. When you have OCD, the warning system in your brain isn't working properly, so your brain is telling you that you're in danger even when you're not, which is what causes your anxiety. People with OCD have to perform daily rituals that get in the way of their everyday lives. Many of the most common compulsions, which are the behaviors, include constant checking, cleansing, counting, and other repetitive behaviors. So a person who suffers from OCD might have a repetitive behavior such as knocking on the door 8 times before they can open it. This type of repetitive behavior happens because the person has fear that something bad will happen if they don't perform this ritual. And when they don't perform this ritual, it causes them anxiety and distress. So biological research for the causes of OCD has found a link between OCD and serotonin. Serotonin is a chemical in your brain that has to deal with hunger, mood, aggression, sleep, impulse control, and other things. So for individuals who suffer from OCD, they have insufficient amounts of serotonin in their brain. So they have to take medication that increases the levels of serotonin in their brain, therefore decreasing their anxiety. So on the right, you have a brain scan of a normal brain, and on the left, you have a brain scan of a person who suffers from obsessive compulsive disorder. The warmer colors, such as the reds and yellows, indicate regions in the brain with high activity. Now both of these images were taken while the brain was at rest. So as you can see, the individual who suffers from obsessive compulsive disorder shows more activity in the frontal cortex, basal ganglia, and thalamus than the scan of the normal individual. Now OCD does not necessarily mean someone who is very organized and has a fear of germs and contamination. OCD can also include hoarding disorder, which is an obsessive compulsive disorder in which the person cannot get rid of certain items, and when they do, it causes them anxiety and distress. So I hope you were able to gain some insight on the science behind obsessive compulsive disorders. Thanks for watching!